Good morning, students. Today I will just give you a practical demonstration of the important cranial nerves. Mind it, those which are important for the exams, only those cranial nerves I will demonstrate. I will not go to any of the theoretical part. That is something which you will have to learn from what has been given to you as your study material, or from any book you can also study. I will only show you the practical part, how it is to be done. Please notice everything what I am trying to do. Now, the first cranial nerve, that is olfactory nerve, is usually not given in the exam. So, I am omitting it. If you are asked to test the second cranial nerve, that is the optic nerve, what will you say? You will first say the optic nerve has three important tests. One is the acuity of vision, next is the field of vision, third is the color vision. So, we will start with the acuity of vision. Mind the spelling, A-C-U-I-T-Y, there is no Q. Acuity of vision can be for distant vision, it can be for near vision. For distant vision, the chart that is used is called Snellen's chart, S-N-E-N-N-E-N''S. The Snellen's chart contains many letters of different sizes. A, you see A is the biggest, and the last line A-U-T-H, this is the smallest. So, why they are of different sizes? That means that the topmost letter can be read from a distance of 60 meters. See, over here it is written 60. So, the topmost letter A can be read from a distance of 60 meters. The next one is 36, next one is 24. You don't have to memorize. It is written, everything is written over here. Just keep your eyes open. 24, 18, 12, 9 and 6. So, that is how you are supposed to read. Now, what you do is you place this. It is not possible to place it at a distance of 60 meters and then again bring it forwards and place it at 36 meters and so on. So, what is ideally done is the subject is asked to sit at a distance of 6 meters. So, at a distance of 6 meters, he will be able to read this line. He will be able to read this line. Okay. So, one by one I am going to test the eyes. So, you have to test each eye separately. Suppose this is the distance of 6 meters. You can understand our problem. So, I am just keeping it over here and I will ask her to read one by one from above downwards. একটা চোখ বন্ধ করো, each eye has to be tested separately. বাঁ চোখটা বন্ধ করো, এরকম করে বন্ধ করো। হ্যাঁ, ঠিক আছে। এবারে তুমি ওপর থেকে পড়তে শুরু করো। ঠিক আছে। So, she can read the alphabets which are written above 6. That means her vision is 6 by 6. Numerator 6 means the distance at which she is sitting, and denominator means the line which she can read. Suppose she can read up to HTOV, this line. That means her vision will be 6 by 12. If she can read this line, then it will be 6 by 24 according, but 6 will remain constant as she is sitting at a distance of 6 meters. এবার এই চোখটা বন্ধ করো, ডান চোখটা বন্ধ করো, বা চোখ দিয়ে দেখি বলো। ঠিক আছে, ছাড়ো। She can read again the same. Up to this line she can read distinctly. So, her vision, left eye 6 by 6, right eye 6 by 6. Therefore, she needs no correction. That is about the distant vision. As I have said, each eye is tested separately. Now, if the person at a distance of 6 meters cannot read the topmost line also, that is the 60. She cannot read even the topmost letter. Then what you do is you take her forwards. You take, as this is fixed on a wall over there, so you will have to take your patient 1 meter in front. So now the numerator becomes 5 meter, and if she can read 60, it will be 5 by 60. If she cannot read that, again 1 meter, 4 by 60. If cannot read, 3, and so on, up to 1 meter. If she cannot read that, then what you do is you ask her to count your fingers. Dekhi, kota angul, bachok bondo koro, kota angul. 4. She can read. Then you ask the person to count the fingers. Next, if that is not possible, then wave your hand, hand movement. Counting fingers, next is hand movement. If even that is not possible, then light is projected. Light is projected. Perception of light, PL, perception of light, whether she can perceive the light. And projection of light is once she can perceive the light, now you will project from different direction and ask the person whether she can read, whether it is coming from the right side, I'm sorry, not read, whether she can feel the light from the right side or the left side or above or downwards. So these are the tests for the distant vision. For the near vision, there is no chart over here. It is a Jaggers chart. It will not be given for you. So I will finish my discussion on the acuity of vision. Now I will go to field of vision. In order to test the field of vision, two things are important. One is the position of the patient with respect to you. আমার দিকে মুড়ে বসো এরকম করে আরো পুরো একদম পুরো হ্যাঁ This distance should actually be 1 meter. 1 meter. In order to understand 1 meter, I say that this is almost 18 inches. This is 18 inches. So you hold your hand like this. তোমার হাতটা এরকম করো আমার মতন এই হাতটা আর একটু নিজের কাছে নিয়ে যাও হ্যাঁ Yes. So this is ideal. 18, 18, 36 and 3 inches. 39 inches, 1 meter. So this is the distance at which the two persons will sit, your patient and yourself. Secondly, the eyes should be in the same level. The eyes should be in the same level. Now, what is important is that her field of vision of the left side is the same as the field of vision of my right side. Her field of vision of the left eye, that side, is the same as the field of vision of my right eye. So when I am testing her left eye field of vision, I will ask her to keep her left eye open and close her right eye. ডান চোখটা বন্ধ করো ওরকম করে বন্ধ নয় See, she was closing it like this ওরকম করে না because why? If she puts her hand like this, this is a cup shaped, so that is obscuring her field of vision. That is why best thing is to ask her to hold it like this এরকম করে বন্ধ করো হ্যাঁ এরকম করে বন্ধ করো Now when I am testing her left field of vision, I will have to test my right field of vision because they are the same. So similar thing I will do myself also. Her right eye is closed, I will close my left eye. এবার আমার এই আঙুলটা আমি মাঝখানটায় রাখবো তুমি দেখতে পাচ্ছ কিনা বলবে আমার চোখের দিকে তাকিয়ে থাকবে very important. Ask the person to look at your eye. She will not move her eyes. চোখটা ও নাড়াবে না. She will look at my eye. I will also look at her eye. দুজনে শুধু চোখাচোখি হবে কোনো মতেই চোখটা কিন্তু নাড়াতে পারবে না. She cannot move her eye. And now what I will do, I will hold my finger midway in a plane, midway between the two of us. দুজনের মাঝখানে, this is the midway. আমার চোখটা এদিকে, আমার চোখের দিকে তাকিয়ে থাকবে, চোখ নাড়াবে না. All these directions to the subject should be given loudly so that the examiner can hear it. এবার দেখতে পাচ্ছ কিনা বলো? দেখতে পাচ্ছ? দেখতে পাচ্ছ? দেখতে পাচ্ছ? আচ্ছা এদিকটা দেখো, দেখতে পাচ্ছ? দেখতে পাচ্ছ? ঠিক আছে। Now that is the horizontal plane. Vertical plane দেখতে পাচ্ছ, দেখতে পাচ্ছ, দেখতে পাচ্ছ? You have noticed probably I was moving my finger. Actually it is easier to see a moving object than a stationary object. So her right side, her left-sided field of vision is the same as my right-sided when it is, so that means her left-sided field of vision is normal. এবার I will do just the reverse, উল্টোটা করো, এই চোখটা বন্ধ করো, হ্যাঁ আমিও I have also closed my eyes. Now I will place my finger in a plane midway between the two of us. What will I ask her to do? চোখটা বন্ধ, তোমার চোখটা ডান চোখটা আমার মা চোখের দিকে তাকিয়ে থাকবে, চোখ নাড়াবে না। This is the midway, একদম এক্সট্রিম নিয়ে যাবে, take it to the extreme point, দেখতে পাচ্ছ? That means her field of vision lateral side, temporal side is normal, nasal side normal. দেখতে পাচ্ছ? দেখতে পাচ্ছ? দেখতে পাচ্ছ? So her field of vision is normal compared to mine. That is how you will express. Your reporting will be the field of vision of the subject is the same as compared to mine. Next, I will move on to the third, fourth and sixth cranial nerves. Now the third, fourth and sixth cranial nerves are tested together. Why? Because they supply the extraocular muscles of the eyeball. So that is the best is they are tested together. All the extraocular muscles of the eyeball are tested by the third cranial nerve, are supplied by the third cranial nerve, except the lateral rectus supplied by the sixth cranial nerve and the superior oblique supplied by the trochlear nerve. So that is how I am going to now how to test. I will show you how to test. I will fix her head. First thing I will do is I will fix her head. So because if I don't fix her head, what will she do? আমার এই দিকে থেকে আঙুলের দিকে তাকাও তো, আরো তাকাও, আরো তাকাও, আরো তাকাও. She will move her head. So I don't want that. So that is why I will ask, I will place my hand over her head. And also I would like to tell you, students, that during the examination, it is a very problem. You're all nervous. You don't know what to do with your left hand, whether to scratch your own head or keep it in your pocket or bite your nails. So best is to utilize the left hand, keep it on the patient. That will be very comforting for the patient also. So I am placing it like this. Now I will ask her, আমার আঙুলের দিকে তাকাবে, আমার আঙুলটা যেদিকে যাবে আমার আঙুলটা তার সঙ্গে সঙ্গে দেখবে, এ দেখো এদিকে তাকাও. So there is lateral movement of the right eye, medial movement of the left eye. So therefore right eye lateral rectus, left eye medial rectus. Now in this position I will lift it upwards. এদিকে দেখাও আঙুলের দিকে, হ্যাঁ, see, right eye superior rectus, left eye inferior oblique. এবারে এদিকে তাকাও নিচের দিকে, হ্যাঁ, right eye inferior rectus, left eye superior oblique. So this is on the right side. Similar thing I will do on this opposite side again. আমার আঙুলটার দিকে তাকাবে, তাকাও, এদিকে তাকাও, হ্যাঁ, left eye lateral rectus, right eye medial rectus, ওপর দিকে, left eye superior rectus, right eye inferior oblique, নিচের দিকে, left eye superior inferior rectus, right eye superior oblique. What will be your reporting? The extraocular muscles of the eyeball are functioning normally. So the third, fourth and sixth cranial nerves are functioning normally. Now the third cranial nerve also has two important reflexes which are to be taught. One is the light reflex, the other is the accommodation reflex. For light reflex means that when you focus a light on the eyeball, on the pupil will constrict. There are two parts of the light reflex. One is direct, the other is indirect or consensual. So to the examiner, if he asks you to perform the light reflex, first thing you will say is, Light reflex has two parts, direct and indirect. I am doing the direct first. So what I do is, you will have to focus the light from the side. You will have to focus the light from the side. You can test each, you will have to test each eye separately. It is not absolutely necessary to close the opposite eye. It is not necessary. What will be your direction? Again, I am placing my hand on her head to fix her head. Durer dike takao. Durer dike takao. What does it mean? That means I am asking her to relax her accommodation, because accommodation produces constriction. So whether the constriction is due to light reflex or accommodation reflex, it is difficult to understand. So you ask her to look at a distance and keep the pupil widely dilated. And moreover, if a dilated thing constricts, the movement will become more easy to visualize. That is why. এবারে আমি এই লাইটটা তোমার চোখে ফেলবো, তুমি কিন্তু দূরের দিকেই তাকিয়ে থাকবে, লাইটের দিকে তাকাবে না। So I have described the procedure to her, and then দূরের দিকে তাকাও, দূরের দিকে তাকাও। You have seen what I have done. I have brought the light from the side, and I have observed her. I have observed the constriction of the pupil. That is very important. You will not do it like this, dakho, dakho. So that way you are not actually visualizing the reflex. That you cannot do. That is number one. Second, I have seen many students doing during the exam, because they have been asked to bring the light from the side. Left hand, তারপরে আস্তে আস্তে right hand, তারপরে side থেকে এনে। So this is not the method. This is not the method. Why not? Because when you are bringing the light from the front, the person will have a tendency to look at the light. And whenever he looks at the light, there will be accommodation. There will be constriction of the pupil. So whether the constriction is due to accommodation or it is due to light, you will not be able to know. That is why you will have to focus from the side. So the right-sided direct light reflex I have already done. Now coming to the left side, similarly, দূরের দিকে তাকাও, দূরের দিকে তাকিয়ে থাকো, মাথা নাড়াবে না। What will be your observation? Constriction of the pupil. Now coming to the indirect light reflex. This I will show it only on one side. So indirect light reflex now, I will show only on this side. That means indirect light reflex mane holo, you are focusing the light on one eye and you are observing the constriction of the pupil of the other eye. So what you do is, দেখি দূরের দিকে তাকাও, আবার দূরের দিকে তাকাও is very important. এবারে you ask her, এদিকে হাতটা এরকম করে রাখো, দেখো, হ্যাঁ এরকম করে, so that না so that when I focus light over here, the light will not come in between the nose and her finger. This is how she will hold her hand, and I will focus from that side and I will observe her right pupil. So what I will do is, দেখি দূরের দিকে তাকাও, I could have done it like this also. Focusing from this side, and হুমড়ি খেয়ে পড়তাম ওর গায়ের ওপর, তাই তো ওর ওই চোখটা দেখতে গেলে ওর গায়ের ওপর হুমড়ি খেয়ে পড়া। আর এখন তো সোশ্যাল ডিস্টেন্সিংয়ের জন্য you should not do that. So it is best to focus on that side and look for the constriction on this side. This is the indirect light reflex, and the cause is bilateral innervation. Next we come to the another reflex, that is accommodation reflex. নাকটা ঠিক করো, নাকের একটু ঠিক করো। Accommodation reflex means first you ask the subject to look at a distance, and then you will place your finger about 10 to 15 centimeter in front of the bridge of her nose, like this is the distance. And first at a distance she will look, the pupil will be dilated. Then you ask her to look at the tip of your finger. That at that time, you will have to see properly for the constriction of the pupil, for the medial convergence of the eyeball. These are the two findings which you can see. And there is a third finding where there is a bulging of the anterior surface of the lens which cannot be seen by the naked eye. So what you will observe is medial convergence of the eyeball and there is constriction of the pupil. So I will show you 3 or 4 methods and you will say which is the correct method. First method, দূরের দিকে তাকাও, আমি যখন বলবো তখন আমার আঙুলের দিকে তাকাবে, আমার আঙুলের দিকে তাকাও। This is number 1. What have I done? The method is right, but did I go and see whether the pupil is constricted or not? I was looking like this, I was standing over here from a great distance, so I did not see the constriction of the pupil. So this is a wrong method. Next, দূরের দিকে তাকাও, আমি বললে আমার আঙুলের দিকে তাকাবে, আঙুলের দিকে তাকাও। There is closure of her eyelid. Is this right? I cannot see anything. I have not seen anything. So that is again a wrong method. So what is another method? দূরের দিকে তাকাও, যখন বলবো আঙুলের দিকে তাকাও। Wrong. You don't have to put your finger right in front of your nose. That will also cause difficulty for the patient. So now the ideal one. I will place my finger 10 to 15 centimeter in front of the bridge of her nose. It should be placed slightly higher up, not like this, but slightly higher up, so that her eyes are open. Then, হাতটা আবার মাথায় দেব, fix her head, দূরের দিকে তাকাও, আমি যখন বলবো তখন আঙুলের দিকে তাকাবে, দূরের দিকে তাকাও, তাকাও. So I was trying to see the constriction of the pupil, the medial convergence of the eyeball. Because of social distancing, I did not go very close, but you should go very close and try to see the constriction of the pupil and the medial convergence of the eyeball. See that, see that her eyes are open. So the wrong methods I have shown, and I have also shown you the correct method. Now, accommodation হলো এবারে হচ্ছে 5th cranial nerve. আমার দিকে ফিরে বসো। Now, 5th cranial nerve has a sensory component, it has a motor component. Sensory component through the ophthalmic, maxillary and mandibular branches. This is the area of ophthalmic above this. From the angle of the mouth, this is the maxillary, and below the angle of the mouth, this is the mandibular, except the part near the angle of the jaw. That is by C1. So the areas for sensations, you have to test the touch, pain, temperature. But during the exams, usually we prefer to give only touch because pain and temperature, it can cause real pain to your patient. That is why we don't give it. We will ask her. Now what I do is for sensory, any sensation, first I tell her that এটা আমি তোমার কপালে লাগাবো, বুঝতে পারছো? হ্যাঁ. So I have explained that what I am going to do. তো আমি যেখানে যেখানে লাগাবো আঙুল দিয়ে আমাকে দেখাবে. Have you heard what I said? আমি যেখানে যেখানে wherever I touch this, you will have to show with your finger the place I have touched. Okay. So I have 6 areas, 2 ophthalmic, 2 maxillary, 2 mandibular. Avoid the joining the demarcation areas. Always try to avoid that. এবারে আমি তোমার কপালে যেখানে যেখানে একটু মুখটা নামাতে হবে, না মুখটা না, এই মাস্কটা নামাতে হবে, এক্ষুনি হয়ে যাবে। আমি দূর থেকে নেব, যেখানে যেখানে লাগাবো বলবে। চোখ বন্ধ করো, ask her to close her eyes. So all the 6 areas I have tested for touch. So, like these are the sensory division of the trigeminal nerve I have tested. Now coming to the motor division supplied by the mandibular nerve. That is, that mandibular division supplies the muscles of mastication, that is the masseter and the pterygoids. For masseter, what do I do? দাঁত দুটো জোরে চাপো, clench her teeth. দাঁত দুটো জোরে চাপো. When she is clenching, I will feel the masseter. জোরে চাপো, জোরে চাপো. See, masseter becomes prominent. Jore chapo, jore chapo. This is the masseter, this is the temporalis. So both I am feeling. Clenching the teeth makes the masseter and the temporalis prominent. Both I have done. Now for the pterygoid. I will ask her to open her mouth. মুখটা খোলো। আচ্ছা, ডান দিকে চোয়ালটা ডান দিকে নাও। চোয়াল ডান দিকে নাও। ডান দিকে এদিকে, 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 ওদিকে নাও। একবার ডান দিকে, একবার বাঁ দিকে। Actively. Now I will offer resistance and ask her to move the jaw side by side. মুখটা হাঁ করো, ঠেলো, আমার হাতটা ঠেলে দাও। হ্যাঁ, হ্যাঁ, ওদিকে ঠেলে দাও, ঠেলে দাও, ঠেলে দাও, খুলতে, খোলো, খোলো, মুখটা খোলো, হ্যাঁ। So these are the medial and the lateral pterygoids. Both the masseter, temporalis and the pterygoids are functioning normally. This is the motor component of the trigeminal nerve. Coming to the seventh cranial nerve, or the facial nerve, which is the nerve of facial expression. It supplies the muscles of facial expression. There is a little bit of history. I am omitting that part. I am only showing you how to demonstrate. So again, what I do is, from above, I will follow a routine that is from above downwards. I will test the different muscles. First thing is, আঙুলের দিকে তাকাও, আমার আঙুলের দিকে তাকাও, আরও দূরে মাথাটা কাজ করে দাও। হয় সো again see what she is doing. She is moving her head. So once again, দেখি মাথাটা সোজা রাখো। হ্যাঁ, first test is what is this? Frowning না তো, wrinkling of the forehead. আমার আঙুলের দিকে তাকাও। See, look at the wrinkles. Frontal belly of the occipitofrontalis. While you are testing, you will name the muscles so that the examiner can hear what you are doing. Arekbar. This is the frontal belly of the occipitofrontalis. Erakom koro to amar moton. This is the corrugator superciliaris. Then the orbicularis oculi, which closes the eyeball. চোখ দুটো জোরে বন্ধ করো, খুলবে না। You will have to do both sides, upper and lower eyelid. Arekbar. Orbicularis oculi. Gal duto pholao. Ha. You will tap on either cheek. Mukh theke hawa jano na beroy, tight kore rakhbe. This is the buccinator. আচ্ছা, দাঁত বার করে, ই করো, ই করো। Levator angulioris and zygomaticus. রাখো, এরম করো। This is the orbicularis oris. Finally platysma. দাঁত দুটো চাপবে আর মুখটা খোলার চেষ্টা করবে। দাঁত দুটো খোলা। This is the platysma on the neck. So রাখো, বন্ধ করো এটা। So all the muscles of facial expression are functioning normally on both sides, and there are a few inspectory findings which has already been taught. I am not going into that. I am only demonstrating the practical aspect that you have to do. So that is seventh nerve, the last one. This is a tuning fork. এত কম কেন দিয়েছো? 102। 512 hertz. So for the cochlear division of the vestibulocochlear nerve, I will demonstrate the tuning fork tests. There are two tests, Rennie's test and Weber's test. For Rennie's test, what you actually do is, actually this, whenever you vibrate a tuning fork, it produces a sound. It produces a sound. So that produces a key type of sound which can pass through the air, that is air conduction. It can also be heard if you place the base of the tuning fork on the mastoid process. You can feel a key type of sound you can hear. So that is called bone conduction. So first you have to demonstrate what you want to do. That is why what you do is, আমি এটা তোমার কানের সামনে ধরবো, তুমি কোনো আওয়াজ পাচ্ছ কি না আমাকে বলবে। পাচ্ছ? ছাড়ো। আচ্ছা, আচ্ছা তো আচ্ছা। Now I will tell the actual test. So now she is conversant with the type of sound which she expects to hear. আমি এটা এরকম করে লাগিয়ে তোমার কানের পেছন দিকে আগে লাগাবো। পেছন দিকে একটা তুমি আওয়াজ পাবে, কী করে, আওয়াজটা যখন বন্ধ হবে হাতটা তুলবে। হাতটা তুললে আমি সেটাকেই আবার এনে তোমার কানের সামনে ধরবো। তখন যদি আওয়াজটা পাও কি না আমাকে বলবে। Have you understood? This is the direction that you will have to give. So, শুরু করছি, হ্যাঁ? So this is where you will strike the tuning fork, not on the table. I have even seen students striking the tuning fork on their shoe. When I was an examiner in some college, I don't want to mention where, striking on the shoe. So never do it. This is the best place. If you don't want to do that, then you can strike it on your hand also, but not করে examiner's সামনে মেরে দিলে টেবিলের ওপর. Never do it. ভালো। শুনতে পাচ্ছ? I will repeat on the opposite side. I am not doing it purposely because of the problem nowadays. So I am not doing it over there. I will show you some wrong methods which you usually do. One method, one wrong method. না, কিছু শুনতে পাচ্ছ না? আচ্ছা, না। Have you seen what I am doing? I have placed the base over here. That is correct. But after that, I have again placed the base in front of the ear. Naturally, you won't be able to hear because the vibration is being produced over here. So that is a wrong method. Another wrong method where many students do is, আবার শুনতে পাচ্ছে না। I have placed the prongs on the back over here. You will not be able to hear anything because the vibration will stop. Another wrong method. No. কিচ্ছু পাওনি? So you have struck twice. But what we want is that the same conduction, air conduction is greater than the bone conduction. You are placing the base of the tuning fork on the bone, striking the tuning fork once, and the same conduction can be heard on the bone first. When the bone conduction stops, as air conduction is greater than bone conduction, so placing the same conduction in front of the ear, you can hear the sound. This is called air conduction is greater than bone conduction. Purposely, I have shown you the wrong ones so that in the examination, you do not do the wrong methods. Maybe you are having a great laugh at home, but this happens. We have seen it. That is why I have shown you all these wrong methods. Coming to the Weber's test. In the case of the Weber's test, you are placing the base of the tuning fork, or you can place it on the scalp, but she has so much of hair. You need a ganja man over here. So that because she is not ganja, so I will place it on the forehead. So that, and ask her whether she hears equally on both sides or not. I will ask her whether she hears equally on both sides or she hears more on one side. এখানে রাখবো, দু কানে সমান শুনছো কিনা বলবে, কোনো এক কানে বেশি শুনছো কিনা বলবে। এখানে বেশি শুনছো, এবারে ঠিক বলো না ওটা। She cannot hear more on any side, so therefore the Weber is heard equally on both sides. This is called Weber is central. If she complains that she is hearing more on the right side, then you say Weber is lateralized to the right ear, and there are many conditions of nerve deafness, conductive deafness, which can produce different results in Rinne's test and Weber's test, which has already been taught to you in your theoretical classes. So I have just demonstrated the important cranial nerves. On top of this, I did not demonstrate the jaw jerk for the fifth cranial nerve. Ekটু মুখটা খোলো. You can do this. This is a percussion hammer. মুখটা একটু হাঁ করো, একটুখানি হাঁ করে ঘুরবে, একটুখানি। হ্যাঁ, you will place your thumb over here and strike the jaw. The jaw, there will be a contraction of the jaw, but actually it is prominent, it is found only in an upper motor neuron lesion. It is not normally found. That is why I did not show you. Later you will be taught about the different reflexes, the different deep jerks, and your superficial jerks will also be taught to you later. Thank you.